So we got the question this week, why do we like to do so much active care? So the example I'm going to give you is from an interesting patient case I had when I was living in Tulsa. The coolest thing about this case, it was a very active CrossFitter, someone you wouldn't think would be in pain, but they were starting to have a lot of pain on their deadlifts and a lot of pain in their squat. So my favorite thing to do with low backs is, obviously we're chiropractors, so adjust, and I really like needling. So with this person, if you can visualize this being their sacrum, right where the hips are and the low back meets, that's where the pain was. So the cool thing here was I would needle them, adjust them, I would give them some of our McKenzie therapy that we've talked about before. It seemed to do the trick. However, a day later, they would come back and have the same exact pain. So I was scratching my head. This treatment was lasting for a lot longer than it should have. And finally, we decided to add some active care in. So what we like to do is coach what we call IAP, which stands for intra-abdominal pressure. The intra-abdominal pressure actually stabilizes your spine. So when people think of core, we think abs, right? But really what core is your spinal stabilizer. So when we coach this breathing to create the IAP, it actually helps relieve a lot of our back pain. So I was able to get this person doing kettlebell swings. And these kettlebell swings can be very difficult if people have low back pain, but when we coach this IAP along with the other treatments, after 2 visits, pain went away. So again, we were asked this question a lot, why do we do so much active care? The reason is if we can stabilize the spine and get them moving, it really helps relieve a lot of pain. So guys, if you're having problems with low back pain or you've seen a chiropractor and just been adjusted and or needled, that's what makes us a little different is we add this care, this active care into our treatment plan. So give us a shout if you're having back pain and not having any success with it.